Newark Wayne Community Hospital is a 128-bed rural community hospital. We have a full line of services. Our patient experience team is a group of 6 committed folks who meet dedicated to the patient experience, including frontline and senior leadership, process improvement, and program management. Our patients were reporting low scores on our patient satisfaction surveys, which wasn't in line with the level of care that we pride ourselves in delivering. As a team, we came together to understand where opportunities truly lied, and that's where our program management and our process improvement folks really supported us analyzing the data to pinpoint where our opportunities were. We took those opportunities and looked at what metrics we could use to measure our success so that we could use the measurement of those metrics over time to track our progress.
I'm the executive director of the Monroe County Medical Society. We are an advocacy organization that represents more than 1,200 physicians here in Monroe County and the 6 additional counties of the Finger Lakes region. A number of years ago, we formed the Quality Collaborative, which maintains 18 clinical community guidelines that are kept up to date by physician experts in a given specialty. Hypertension, at its simplest, is high blood pressure. We had set some goals to improve outcomes for hypertensive treatment. The goal of the study was to take a look at how well could a guideline that was created locally be implemented and used by physicians here in town. There are national guidelines put out by national specialty societies within cardiology. I think part of the success of the guideline implementation here in Monroe County is the community and the closeness of the community of the physicians here, as well as the opportunity for direct input by those physician experts in a given specialty.
The organization that I work for is Rochester Regional Health. We consist of 5 hospitals, ambulatory services, and a large inpatient population that we serve on a daily basis. The project that we got into had to do with trying to decrease length of stay in a certain population. The population that we kind of targeted was patients that were in the hospital that were going to be making a transition into a nursing home. When you have a low length of stay, it directly affects your patient experience. We used Lean Six Sigma tools and methodologies to kind of drive our focus on where we were going to go with the project, along with some of the scripting that we were using when we were doing that actual in-time, at the bedside conversations with patients and families. To be able to give patients and families that same clear understanding of what we're going to need to do when it comes to discharge planning and how we're going to collaborate with them is quite important.
University of Rochester Medical Center is an over 800-bed tertiary care medical center. The team that worked on this improvement project was mainly from the emergency department. This project was aimed at reducing the amount of time it took to get septic patients with severe infections, antibiotics in our emergency department. We did lean mapping of the entire ED process from the time the patient arrived to the time that they left the ED, and looked at opportunities where we could impact and change the flow so that care could be received quicker, and in this case, antibiotics administered in a more rapid fashion. So many patients come and need care of a variety of different modalities. Patients come in needing stroke care, needing heart attack care, needing all sorts of care, and the emergency room has to quickly identify them and treat them appropriately. The unit-based performance teams are important to our patients because they provide ways to improve our patient care at the patient bedside. These teams are multidisciplinary, including physicians, advanced practice providers, nurses, pharmacists, physical therapists, nutritionists, residents, fellows, all working together to collaborate and improve care at the patient bedside. It's been known for some time that the way you really improve care is in team-based care. You can't provide improvements in care just from the top down. You can't have your CEO or CMO or CNO say we're going to do things this way, because the caregivers at the bedside are the ones that are seeing the patients day to day, and they can really have the biggest impact on improving care at the bedside.
Trillium Health is a non-for-profit community health center. We specialize in both primary care, and specialty care. For primary care, we're an LGBTQ confirming healthcare center, and we also focus on patients who have well-known barriers to care. The area of improvement that we really needed to focus on was our movement in becoming a federally qualified health center lookalike. We were used to doing this really well for a small population, but knew that we actually had to launch into a complete change management effort for our team and sometimes our patients. So we actually did a complete workflow analysis of every workflow for every single type of patient that comes through. After we looked at our workflow, we redesigned them to make them more efficient, to make them more customer focused, to make them more team or staff member focused. I think because of all these process changes, our patients really are seeing these changes and seeing everything that we've done to improve things from not only a quality standpoint, but a communication standpoint. A standpoint that actually makes them feel important when they come here and that their time is valuable.
Hillside Children's Center has been around since the early 1800s. We're a very large child and family not-for-profit. Specifically, the outpatient clinic. We serve around 800 children and their families. The project was really trying to find a standardized way of identifying which of our 800 clients would be highest risk. So we came up with probably I think 8 different definitions around what we thought meant or what it meant to be high risk. And we had to agree upon that. And then when we had those definitions in front of us, we had to figure out a standardized way of capturing that information. We have the assumption, especially with older time staff, that there's this shared understanding of what risk is, and there's not a shared understanding. And so I think the benefit was this was not just about educating our newer clinicians, but really educating some of our old timers to think differently and to challenge their own perceptions of what risk is.
So Hillside Family of Agencies is an organization, non-for-profit, that focuses on, have a comprehensive array of services for youth and families in the areas of education, health, and human services. The project itself, it is effective supervisory review of documentation, and it was completed by one of our most senior program manager, leader, I should say, on our campus. And the purpose of that is to explore the EMR, which is relatively new to our organization. What we found is that in the process of doing it, what we didn't know was that there were thousands of records just in what we call a queue, and not being generated or not being reviewed because people did not understand the process. So it was upward of thousands, and it also reduced supervisor time by over 15 hours. He piloted in a section of our campus. We have 5 distinct programs, but he piloted in one program. And during that pilot is when he found that there was opportunities for improvement there. The project not only impacted our campus, it impacted the agency on a whole.
I work for Monroe Veterinary Associates, which is a group of veterinary practices in the Greater Rochester area. We provide small animal general practice and emergency specialty care. We're an organization that's been around almost 50 years, and we were trying to continue to develop and enhance and improve. So the Continuous Improvement Project was a great match for our organization to start changing the way we looked at opportunities or problems. I think at this point we've probably had 30 or 40 different process improvement teams that we've had. We've had some that go across all of our veterinary practices, and we've had some that are in individual hospitals. We could see that some hospitals would have 80% compliance from their clients, and other hospitals would have 40. So we use the process improvement process to map that out and evaluate the education and the utilization of the staff.
So my project focused on the Forever Friends Pet Crematorium, which is located in Fairport, New York. Our building and our business does both private cremations and communal cremations for all of Greater Rochester. The main purpose of our project was to be more efficient as an operation. Part of this project was making our staff more efficient, and this means avoiding overtime. This means getting as much work done as possible within the work week. It also meant avoiding any backlog in our processes. The end result was to come up with different ways of scheduling the staff and also different ways of processing the requests that were coming through to the crematorium. So that made us work a lot more efficient and faster and in a predictable way.
About 10 years ago, the diocese made a move to combine 5 individual parishes together as one under the name of St. Cattery. And we used 3 of the churches, St. Cecilia, St. Margaret Mary, and Christ the King. So for the past 6 years, I've been pastor there. And over that time, we've discovered that trying to pull together the finances from 5 different parishes that did things in different ways led to some difficulties. So when I brought in the Director of Finance and Administration, Carol Wilkie, I asked her to help me to work on that. So she immediately started applying the quality tools to the situation. From there, Carol is the kind of person who leads by example, and that was an important step to get the people who work in the finance and administration area. And then they went into teaching the rest of the staff. The parishioners themselves are owed our doing our job correctly, to be assured that we're not going to go bankrupt or misuse their funds, the funds they so kindly give to make sure that our parish is working well.
A couple of years ago, our document testing lab was really just a job shop that processed requests that came from customers as stated. They operated largely manually with some use of spreadsheets and without any centralized communication or organization amongst the team. They were faced with the challenge of needing to reduce their costs while at the same time improving their capabilities and level of service.
Our project was really around improving our customer interaction, improving our resource management, and improving our test operations and data management. The big piece of innovation was the scheduling tool, and that really opened up opportunities for us.
Through this scheduling system that they put in place, they can see where their test is progressing from the time they submit the request until they get the data back. And the engineers in this group fully participate now in product launch reviews and problem-solving sessions to provide real tangible information on what the testing is showing.
Butler Teel is a media agency. We are based out of Rochester, and we have a couple of offices throughout the states. We have about 120 employees, and our passion is quality. In our agency, because we were growing so fast, everybody was adding their personal touch to the tools, and that personal touch is what helped us provide a service with customer intimacy. But when we are adding things with a personal touch throughout an entire process, every single time that we're working with a client, we are creating a lot of customized and specific tools for that specific client. Our job was to try to identify the best practices within all of those versions that we have, what we had from that one tool, and then figure out, okay, what is the most important content out of this specific tool that is going to help us ensure a high quality, a consistent high quality service.
Gore Bell, as a market leader, provides material handling and material lifting solutions for customers to solve their problems. Kaizen really is all about change for the better or change for good. And traditionally, Kaizen is affiliated with manufacturing or operations, but actually it is also important to use in process-related things. In the last 18 months, Gore Bell has conducted 21 Kaizens across our campus, and the results that have been delivered have been incredible. We have metrics for each one of the Kaizens, and just to point out a few, one of the Kaizens, we took a look at our practice of cycle counting parts. And in order to count one particular part on a monthly basis, it took over 5 minutes. The Kaizen team got together and figured out how to perform the same cycle count in 3 seconds. And one of our Kaizens took a look at a process that we use to create a daily schedule adherence report. And this particular process once took 4 hours. And a Kaizen team wanted to improve that, and they had a desired outcome to take that from 4 hours to 3. At the end of the Kaizen, the team delivered a process now that only takes 1 minute.
Highland Hospital was founded in 1889. It is the oldest hospital in Rochester. Highland's biggest value is obviously following the I-CARE values, which stand for integrity, compassion, accountability, respect, and excellence. One major complaint we heard with patients when I first started was that if there's an issue with workers' comp or a type of insurance or coverage, they're held up at the pharmacy after they've been waiting for 2 hours to try and get out of their hospital bed. We were able to come up with a core team from the different areas of the hospital with social work, our physician's assistants, our care coordinators, and our nursing staff, along with a couple of the providers in the surgical areas, and sit down and hash out basically the best way to provide these medications to these patients at the time of discharge. Once the patient discharge order was started, it was just a continuum of contact between nursing, pharmacy, social work to make sure that they received their meds no matter what had to be done.